Hey everyone, I'm Dr. Lachman from Cool Dental. Let's talk a little bit about how the jaw functions. Here's a model to show you how the jaw is functioning. Okay? It's meant to be the side of the head. Here's your jaw joint, here's your upper jaw, here's your lower jaw. So same thing, there's the upper teeth, lower teeth, jaw joint, big muscle, temporalis muscle, that's your main steering mechanism. When you're chewing, the way the jaw is designed to function best is you got your big molars near the back where all the chewing's supposed to happen. So I'm going to talk to you about a nutcracker because that's what most people can understand better than looking at this funny diagram. So let's put this down and look at a nutcracker. If you can imagine, this is your jaw joint, and this close to the jaw joint is where your molars are. That's the way the nutcracker is designed to function. When you crack a nut, when the nut is close to the hinge, it's easier to break the nut. The levers and the force required here makes this nut break with relative ease. If you were to move the nut over here and try to break it, you would need to squeeze with probably 5-6 times more force, and it would be extremely difficult to break a nut over here. So the reason I use this analogy is because here's your jaw joint, that's the hinge of the nutcracker. The molars, the big roots, the big bone, the big teeth, where all the muscles are, that's closer to the hinge because that's where you're supposed to be chewing. People who are missing most of their back teeth, they have to chew in the front. Chewing in the front is like taking the nut and moving it over here far from the hinge. Chewing in the front causes you to overstress the muscles. You overstress the muscle, you overstress the joint. You're setting yourself up for problems down the road. So, kind of like this diagram here, do everything you can to keep your back molars. I know the back molars often get bigger cavities. The bigger cavities can lead to more expense to try to fix the teeth. More common to get gum disease around the back molars. But what I'm saying is, don't just automatically think, oh, my tooth, it's at the back molar. I'm just going to pull it. It doesn't show when I smile. I want to save the front ones and forget the back. Well, I see this a lot. And these are the people who are more at risk of jaw joint problems, more at risk of muscle strain, more at risk of muscle pain. And when you're only chewing in the front teeth are not designed to grind up a sandwich or something like that. And so the front teeth often end up breaking as well. So do your best to try to save the back teeth. That's the way the human body is designed to be chewing. If the tooth has to be lost, please look at some form of replacement, whether it's a partial denture, whether it's a bridge, or even an implant. Because if you're only chewing out here and not chewing back here, chewing becomes far more difficult than you may realize. Hopefully that was helpful. Thanks.